Hello, I'm Pearl Venema, Chief Executive Officer of Hamilton Health Sciences Foundation. Life during the COVID-19 crisis is filled with uncertainty and anxiety for all of us. But the emergency departments across Hamilton Health Sciences continue providing essential services to the community. Dr. Alim Pardhan is an emergency department physician and site chief of the Hamilton General Hospital Emergency Department. Today, he'll be speaking about the changes made in the emergency department to keep you safe during the pandemic and why patients who need emergency help should not delay. For today's episode of Innovations in Vital Care, it's my pleasure to introduce Dr. Alim Pardhan.
Hi, everyone. My name is Alim. I'm an emergency physician at the Hamilton Health Sciences. So I work at the two general sites in the city. So that's the Hamilton General Hospital, as well as the Juravinski Hospital. And I also work at McMaster Children's. In addition to that, I'm the site chief for the Hamilton General Emergency Department, and I'm the program director for the Specialist Emergency Medicine program at McMaster. So I'm going to be talking a little bit about some of the changes that we've made during COVID-19 at the hospitals. And so to give you a sense of the hospitals that I work at, so this is the Hamilton General site, which is our regional center for trauma, cardiac, neurosciences, which includes stroke and spinal injuries, as well as vascular surgery. And in addition to being a regional center for all of the above services, we also serve as a community hospital for downtown Hamilton, as well as the north end of Hamilton. The Juravinski Hospital, which is on the mountain, is adjoining the Regional Cancer Center, and we support a large number of oncology patients as well as the oncology services that run at the Juravinski. And finally, McMaster Children's Hospital, which is our Regional Pediatric Emergency Department and Regional Pediatric Trauma Center. So to give a sense about how COVID-19 has been going is we've been planning for COVID-19. We started planning in late January and early February while we initially started hearing reports of COVID-19. This is, of course, while everything was still open and we were all still able to go to restaurants and movie theaters. And during that time, we were having lots of planning about how to manage the individual patient who came in with COVID, how to manage if we had a big surge in volume, which fortunately we did not see to the same degree as Italy and New York, and also how to function in our emergency departments. Our emergency departments, for those who have been there, are generally quite open concept. We have to keep good sight lines that we can see all of our patients. So not really well designed for managing lots of patients who may potentially need isolation. And so that was a big point of discussion about how would we manage that. Now, fortunately, we did not see the spike that we were fearing, which was good. But we did have to make a number of changes in the hospital as well as in our emergency departments to keep both our staff as well as our patients safe. So to give a good idea about what happened is when you initially arrive, everyone gets screened on arrival to the emergency department. So if you're walking into the emergency department, your first stop will actually be a screening station where one of our wonderful screeners will ask you about what symptoms you have, where you've traveled, and then we'll give you a mask. Everybody is wearing a mask in the hospital right now. And if you're coming to the emergency department, they'll direct you to where to go next. And if you're going to a clinic, then they'll help you get to the clinic that you need to be at. And as I said, everybody is masking. And so, when you come into the hospital, you'll be given a mask that you'll wear for the duration of your stay, they're masks that you put on. And then when you leave the hospital, you can just throw it out. So if you're in our waiting room, you'll notice that we have our wonderful caution tape where we've barred off some of the chairs, mostly so we can maintain physical distancing within the waiting room. Because of this, as well as some of the other restrictions in the hospital, we are restricting the number of visitors that patients may have with them at any time. We are, allowing essential visitors to come, particularly in the emergency department where there might be a language barrier or we might need help with history taking. But we are trying to limit the number of people who are in the hospital, again, to keep our patients and our staff safe at all times. The emergency department, as many people know, is divided into several different areas. And so while we were planning, one of the things that we were working on is that how do we divide patients into those who may have COVID and those who likely don't have COVID. And so we've actually allocated particular areas of the emergency department for higher risk patients as well as lower risk patients to try and make sure that there's no infections traveling between different patients. You'll also notice in the hospital that the staff are wearing far more PPE than what we normally do. For those who don't know, PPE stands for personal protective equipment. And so in general, when we're at work, at the very least, we're wearing a mask for essentially our entire shift. And so here is me wearing my mask. We're also wearing eye protection. And so eye protection could either be safety glasses, which is what I'm wearing here, or a visor. So a visor is a big plastic shield that goes over your entire face. And that's to protect us from getting droplets in our eyes when we're seeing patients who might be coughing or sneezing or vomiting. And then, of course, our lovely and very fashionable yellow gowns that we're wearing to protect droplets from ending up on our clothes or on other things. And then oftentimes, if we're examining people, we'll be wearing gloves as well. So this is in addition to, of course, lots of hand washing, and our environmental services have also been very busy because we're doing a deeper clean in a lot of our areas where there may have been potential COVID patients. The other thing that we actually found, particularly at the general site, is we did not have a lot of rooms that were well designed for us managing isolation patients who needed resuscitation. So these are our sickest patients who need help with breathing or who come in as traumas. And so a lot of our rooms were very open concept. And so actually over the past few weeks, we've actually had to redesign a couple of our rooms to have more doors, as well as install HEPA filters in them so that we could keep them clean and make sure that if there were infectious particles in the room, that they weren't spreading to the rest of the emergency department. So this is a picture of one of our isolated resuscitation bays. And so you'll notice that there's a door here. This actually was one of our initial isolated bays, but it's got a door on it. It's got, there's actually a shower outside this one so we can decontaminate patients if we need to. All of our supplies and equipment are covered. And we've actually got bags of supplies on the outside for things that we might need right away. And this is one of our newly developed isolation rooms. And so again, these doors are actually brand new. They were just installed. The room has a HEPA filter in it, which you can actually see here in the window. And so this is for us to ensure that we're able to keep the room under negative pressure. And so that if there's a patient who's sick or unwell, the viral particles stay in the room as opposed to traveling outside the room. So one of the biggest messages I think it's important for us to talk about is the fact that the emergency departments in Hamilton are still open. They are safe. We're taking lots of important steps to keep our patients and our staff safe. And so certainly if you are having a medical emergency, please do come to the emergency department. We are here to help you if you need it. And so we are still open and the departments are safe, and do come if you need us. Thank you.
Well, thanks for that information. That's very valuable information for the community. You mentioned that, a lot of changes had to be done, and it sounds like they had to be done quite quickly because the situation evolved so quickly. What were some of the challenges of having to pivot and alter things on the fly like that?
So probably for us is we have a large staff. So I mean, if you think about all of the emergency departments in the city, we're probably talking about 60 to 70 staff physicians. We have a large group of residents that rotate to our emergency departments. And then we have a few hundred nurses that work in all of our emergency departments, along with EAs, healthcare aides, child life specialists, respiratory therapists. So there's a large number of people that come through the emerge. And so a lot of it is trying to make sure that everybody was informed of all of the changes that we were making in real time. And so, as changes were being made, probably our biggest challenge was making sure that the information was being pushed out to the staff who needed it as quickly as possible. And also just, it was a change in regular business. So the way that we were doing things was different. And so it was making sure that everybody was informed about what those changes were. And because particularly early on, there were a lot of changes being made on a day-to-day basis. So the policy that we had in place today is not the same policy as we had in place, tomorrow. So there was a lot of changes very quickly. And so the biggest thing was making sure that our team was kept well informed.
And I know there's been a lot of redeployment of resources and personnel throughout Hamilton Health Sciences. Was there a lot of redeployment of personnel for the emergency departments as well?
So not specifically, we didn't move anybody out of the emergency department. So very few of our staff got moved out of the emergency department. We did have plans in place to pull people back to the emergency department if we needed it. Particularly our senior resident group was one of the groups that we would have pulled back to the emerge if we had needed them from a physician standpoint. And there were plans in place for us to pull other staff to the emergency department if our volume started to increase dramatically. So we actually did have plans in place to do that. We never actually had to execute them because, I know a lot of people have spoken. The community did very well from a physical distancing standpoint, which meant that our surge was not as bad as we were fearing.
Oh, good. And you mentioned that there might be some hesitation or fear to visit the emergency department. And I'm sure that would go with caregivers as well, not necessarily the patients. Sort of moving forward, is there any advice you could give to people who think that something might require emergency care but aren't quite sure? For example, is there a number they could call to sort of find out first?
For sure. So your family doctor is always a great resource. So certainly one avenue is to call your family physician. A lot of times they are providing virtual care in the community. And I know there's been a lot of work being done by the family medicine teams in the city to try and ensure that that is available to them. Also, Telehealth Ontario is also available if people are unsure. So telehealth, they can call, they can speak to a nurse on the phone, give their symptoms, and the nurse can help advise them. This is something that can wait to see your family doctor. This is something that here's some strategies that you can use at home, or here is you should go to the emergency department. And so that can also help you decide what the best place is to get care. Also for the city of Hamilton, there's a website you can go to, Need a Doc. I believe is the website, it basically goes and it'll sort of tell you, given your symptoms or what your complaint is, what the best place is to go. So, your family doctor, an urgent care center, or an emergency department.
In the case of people who are experiencing a medical emergency, time is of the essence. So I guess one of your key messages is that it is important to seek help if you do think you need it.
Yeah, and if you or a loved one are having chest pain, you're having difficulty breathing, you're not able to rouse yourself or your loved one, if you find that you're having weakness on one side of your body, uncontrolled bleeding are also good reasons to call 911 and have an ambulance come and assess you and bring you to the hospital as well. So.
I know, especially in the media, there is talk of a potential second wave or even things reoccurring with the virus with the flu season coming on. Do you have any thoughts on the future? And are there any specific plans in place to make sure that Hamilton Health Sciences emergency departments are ready?
For sure. So I think a lot of our planning, fortunately, is we did a lot of this planning with the intention of, we were planning for a first wave, but a lot of those plans are actually still very valid in the event of a second wave. We are also certainly concerned that particularly come wintertime when flu season starts, we're going to have flu season along with COVID, both potentially circulating in the community and how to manage that. So a lot of our plans that we developed for the first wave are actually still quite valid. And we are refining them based on our experience and how things are going to make sure that, if a second wave does come, particularly if we start having a large volume of patients, that we're ready and have plans in place for that. So the plans that we have are good, and we're basically just refining them sort of based on our current experience to see what's working and what's not.
Okay, wonderful. Well, thanks for joining us today. I appreciate that.
My pleasure. Thank you very much. Have a great day.